Good evening, everyone, and thank you for joining us tonight for this Medicare webinar series and tonight's topic, Medicare Options with Medigap and Medicare Advantage Plans, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for its support of this webinar series. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation. Excuse me for just a moment. Ace. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation, or use the raise hand function or the chat area to let us know you have a question. And now it's my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging.
Thank you, Jared. So good evening, everyone. Thank you for joining us tonight for our part 2 of our 4-part Medicare 101 series. Tonight, we're going to be talking about Medicare Advantage Plans and Medigap or Medicare Supplement Insurance. As Jared mentioned, please keep your microphones muted, but I will pause throughout the presentation in order to see if anybody has questions they would like to ask. When I do pause for questions, you are welcome to simply unmute and ask your question, or you're welcome to type your question into the chat box at any time, or you're welcome to raise your hand and let me know that you want to ask a question. Hopefully, everybody received the email that I sent out earlier this afternoon that included the handouts and the copy of the slides for tonight's presentation. If you did not get that email, please feel free to let us know, and I will make sure that that is sent to you again. And I think that's it. So we will go ahead and get started. So just as a reintroduction, I am with the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. The mission of the Area Agency on Aging is to work with our partner communities and counties to develop comprehensive systems that allow people to stay in their homes for as long as possible in our 3-county region for the Area Agency on Aging, which is El Paso, Park, and Teller counties. This presentation is in partnership with the Pikes Peak Library District. We have enjoyed a partnership with the Library District for several years now, and we always appreciate their engagement. And I am the coordinator for the local SHIP program, and the SHIP program, which stands for State Health Insurance Program, is a federally funded program that's designed to provide unbiased and in-depth information and education on all things Medicare. We do not sell anything, we do not endorse any particular companies or products, and we all of our services are at no cost. And give me just a second. Sorry about that. Got people trying to join in that are having a little bit of issues. So Jared, if you're still online, I just forwarded you an email with someone who said that they were having trouble with the link to this presentation.
Thanks, Roma. I'll look at it right now.
Great, thank you. So again, this is a federally funded program. There's a SHIP counselor available, if nothing else, by toll-free statewide number in every county of every state. This SHIP office covers a total of 9 counties in Colorado. I've provided our local Colorado Springs number as well as our statewide toll-free number. So just a brief recap of what we talked about last week. Last week, we talked about Medicare eligibility, enrollment, benefits, and costs for both original Parts A and B of Medicare. So tonight, we're going to talk about the 2 primary insurance options that are available to anybody and everybody who enroll in Medicare A and B for coverage to go with that A and B. So tonight we're going to talk about Medicare supplements, also known as Medigap, two terms for the same thing. And we're going to talk about Medicare Advantage plans, sometimes referred to as Medicare Part C. Both of these options are available to anybody who is enrolled in Original Medicare. They're both regulated by Medicare and the government, but there are limited opportunities or enrollment periods when you would want to enroll in this kind of coverage. So we are going to start by talking about Medigap or Medicare supplement insurance. Medicare supplement coverage or insurance is the term that that is the old school term. It's the technical or the official terminology for that kind of coverage. But it's also known as Medigap, which is the thought process behind the terminology Medigap is that this kind of insurance coverage covers the gaps in your original A and B benefits. So what is Medigap or Medicare supplement insurance? Basically, Medicare supplement insurance is a private insurance policy that you purchase from a private insurance company, and it is solely and specifically designed to pay the balance that Medicare Part A or Part B left over after they paid their part first, period. Let me say that again. Medicare supplement insurance policies are private policies you purchase from private insurance companies, and they are solely and specifically designed to pay the balance that Medicare left over after Medicare paid their part first for Part A and Part B services, period. These kinds of insurance policies must follow all federal and state regulations and laws. They must say on the actual policy itself, Medicare supplement insurance, those three words in that order. Again, the phrase Medigap comes from the thought process that this kind of insurance covers the gaps in your Medicare coverage, basically the balances that Medicare left over. Medicare supplement policies come in several levels of coverage that are standardized, meaning they're set in stone at the federal level, with the exception of the 3 states listed on the slide that have an additional option or 2 to choose from. And the cost for this kind of coverage does vary from company to company. It varies by the level of coverage or the plan level that you purchase. It varies by zip code. It varies by age. So there's a lot of factors in determining what someone might pay in premiums for this kind of insurance. And we'll talk about that more as we go along. So how does this kind of coverage work? Basically, this kind of coverage works with original Medicare Part A and Part B only. So you have to have both A and B of Medicare be enrolled and have them in effect, both A and B of Medicare, in order to even purchase this kind of coverage. There are some situations where you might not need to look at or consider this kind of insurance. That would include if you are already enrolled in a Medicare Advantage plan. You can only have one or the other. You can't have both an Advantage plan and a supplement, just one or the other. Or if you have other options in the form of other creditable coverage. For example, if you are retired military and have access to TRICARE for life, you would not need anything other than TRICARE for life. If you have the option of a retirement health benefit through a past employer, for example, if you are a para-retiree or a federal civil service retiree, or even a retiree from a private employer. If that employer offers health benefits as a retirement benefit, and those health benefits coordinate with Medicare, you may not need anything else to go with Medicare because those retirement benefits may do the job as far as providing that additional coverage to go with your Medicare. In a situation where you have original A and B of Medicare, and whether you get a Medicare supplement or not, because original A and B of Medicare is your primary coverage, that means that your Medicare is good anywhere in this country with any doctor, hospital, or other medical provider that accepts it for any medical need, period. So there is no networks to worry about. There's no service area. There's no provider network. It's good anywhere in this country and or our territories with any provider that will take it. That means it is considered the most portable option to have original Medicare and a Medicare supplement for complete coverage. It's the most portable option for people, especially if you plan on traveling for extended periods of time, or if you snowbird between Colorado and another state, or even if you're just on vacation. Doesn't matter where you're at or what you need, as long as you have a medical need and you have original Medicare will pay their part for that need. If you have a supplement to go with that, the supplement will pay the balance. So who can actually buy a Medicare supplement or Medigap? Again, anybody who has original A and B of Medicare in effect. But you must have both A and B of Medicare in effect in order to purchase a Medicare supplement. There are specific timeframes that are probably better to try and purchase this coverage than others. And specifically, we're going to talk about a guarantee issue period, and we're going to talk about underwriting. In the state of Colorado, we also extend a guarantee period, meaning an option for beneficiaries who are under 65 who become eligible for Medicare due to being on Social Security disability. We extend a guarantee issue period to those beneficiaries. Not every state has the rules that say people under 65 are going to get an option to get a Medigap policy or Medicare supplement policy, but Colorado does. However, because that person is under 65, even though they're guaranteed the ability to get this kind of insurance, I will mention that for people under 65, this kind of insurance is more expensive because you're under 65. However, whether you purchase a Medicare supplement under 65 or not, when you do turn 65, if you've been on disability, when you turn 65, you get a second opportunity to get a Medicare supplement with guarantee at a lower cost. And we'll talk about that, what that means as we go here. So the best time to buy a Medicare supplement or Medigap policy is going to be during what's called a guarantee issue period, also known as the Medigap open enrollment period. This is a time frame that starts as soon as you have both A and B of Medicare in place. As soon as both of those benefits are effective, even if those effective dates are different for both A and B, as soon as you have both of them in effect, that's when your enrollment period starts for this kind of insurance. It lasts for a total of 6 months. And once that clock starts ticking, it can't be stopped. What the 6-month guarantee issue period does is it provides you an opportunity to purchase this kind of coverage to go with your original Medicare A and B, regardless of any pre-existing health issues. If you do not purchase a Medicare supplement within that initial 6-month window, and you have pre-existing health issues, and you try and purchase a Medicare supplement after the 6-month period has expired, you could be subject to underwriting if you try and purchase this coverage from a company. What that means is the insurance companies would be allowed to ask you medical questions on the application. And if they did not like the answers that you gave them, they would not have to sell you insurance. You would be subject to underwriting. So what that means is during the initial 6-month guarantee issue window, they can't do that. You could be on the operating table having brain surgery. If you're in your 6-month window of guarantee issue, you'd be able to purchase any plan with any company of your choice, and they would have to sell you whatever you wanted to buy. That is part of your initial or open enrollment period to get this kind of coverage. But there could be opportunities in the future where you might be able to get this kind of coverage with guarantee issue without underwriting, called special enrollment periods. And as we learned, special enrollment periods, Medicare has them. Honestly, there's special enrollment periods for pretty much everything, as we're going to realize as we go along here. So if you do not purchase a Medicare supplement in that initial 6-month window of guarantee issue. And whether that's because you didn't think you needed it, whether that's because you had other insurance coverage, such as employer coverage or retiree coverage, even COBRA coverage would qualify as creditable. If you have another type of coverage and that's why you didn't purchase a Medigap policy, when that coverage ends, also considered involuntary loss through no fault of your own, or even voluntary loss. You stopped working and you lost your health coverage. Your COBRA coverage expired after 18 months. Anytime you have a loss of other creditable coverage, it does open a window of guarantee issue into any kind of coverage that you want, whether it be a Medicare supplement or even a Medicare Advantage plan, based on that loss of other coverage. In that situation where you are losing other coverage, in the state of Colorado, you would get another 6-month window of guarantee issue and that opportunity to purchase this kind of coverage to go with your original Medicare. If you delayed enrollment into Medicare because you continued to work, and you have that special enrollment period to enroll in Medicare when your work ends or when your employment ends, again, as soon as you're enrolled in both A and B of Medicare, that's when the window of opportunity or the clock starts ticking for guarantee issue into a Medicare supplement only. So if you have this window of guarantee issue, it provides you another opportunity to be able to get this coverage without underwriting, regardless of any pre-existing health issue. Other ways that you might be able to get another window of guarantee issue into this kind of coverage would be or have to do with being enrolled in a Medicare Advantage plan. And there's a couple of ways that could happen. I'm not going to cover them here because I will talk about them in depth when we get to that section of the presentation. But just losing other creditable coverage is not your only opportunity to have another guarantee issue window into a Medicare supplement. There's always going to be exceptions to the rules when it comes to that kind of thing. Again, this kind of coverage is designed to only pay the balance after Medicare pays first. What that means is if Medicare denies paying for a service, the supplement is not going to pay for it either. On the other hand, if Medicare pays for a service, the supplement cannot deny paying their part. These policies, again, are only designed to pay the balance that Medicare left over after Medicare pays first. They absolutely have to do that. They have no choice. As with Medicare, there are some things that these policies do not cover, and it's basically going to be anything that Medicare doesn't cover, including long-term or custodial care, dental and vision services, hearing aids or the fitting of them, doesn't cover private duty nursing, and it does not cover outpatient prescription drugs because, of course, that's going to fall under the newest benefit of Medicare, Medicare Part D, D for drugs, which we're going to talk about in depth next week. All right, so any questions about any of that so far? Again, if you have a question, you can simply unmute and ask it. You can raise your hand or you can type your question into the chat box. Not seeing any questions. I'm not hearing any questions. All right, so let's go on and learn how to figure out how to choose a Medigap policy or Medicare supplement. Again, in the email that I sent you earlier this afternoon, I included several handouts. A couple of those handouts pertain specifically to Medicare supplement insurance. The first handout is this chart that you're looking at now that says 2023 standardized Medicare supplement plan levels. So Medicare comes in parts. Medicare Part A, Part B, Part D for drugs. Medicare supplement policies come in plans. Plans are labeled A through N like the alphabet, which is what this chart is showing us, is the different plan levels that you have to choose from, or the different levels of coverage you have to choose from for Medicare supplement insurance. The plans are set in stone. What that means is no insurance company can alter these plans as they're laid out on this chart in any way whatsoever. They cannot take away benefits. They cannot add benefits to them. They're set in stone. Again, they're labeled A through N like the alphabet. So I'm going to go through these plans real quick, just so you know what benefits are covered after original A and B pay first. So if you look at this chart, we're looking at Plan A. The benefits that each plan covers is listed directly under the plan letter designation. So under Plan A, what we see is basic benefits, including the Part B coinsurance. Basically, what that means is if you buy a supplement Plan A to go with your Medicare Parts A and B, all the coverage you're buying is it will pay the 20% that Medicare left over for Part B services after they paid their part first. Because if you remember, for Part B services, after your $226 deductible, Medicare will pay 80/20 for those outpatient Part B services. Supplement Plan A will pay the other 20% for Part B services only. If we look at Plan B Medicare supplement, it will pay the 20% for Part B services. It will also cover your inpatient hospital deductible. Again, this year, that deductible per admission is $1,600. So Plan B covers the 20% for Part B services that Medicare left over, and it pays your hospital inpatient deductible every time you're admitted. I'm going to jump over to Plan D, as in dog. Plan D covers the basic 20% for Part B services that Medicare left over. It covers your Part A inpatient hospital deductible every time you're admitted. And it covers the skilled facility nursing coinsurance. Again, that benefit is if you are in the hospital as an inpatient for at least 3 days or more, and then the doctor discharges you to a skilled facility for rehab or recovery. As long as you have that 3-day or longer inpatient hospitalization, Medicare pays 100% for the first 20 days of that skilled facility stay. But starting at day 21, Medicare will continue to pay everything except for $200 per day, and that's through day 100. If you have a Plan D or higher supplement, it will pay that $200 per day for you, starting at day 21. Plan D at the very bottom also has a benefit called Foreign Travel Emergency. I'm going to wait to explain that benefit for you real quick until we go through the rest of these plans, because there's half of the plans have that benefit, the other half do not. Let's jump to Plan G as in goat. Plan G, honestly, at this point is considered the Cadillac of Medicare supplement plan levels. It has the most benefits for the best price. Covers the 20% for Part B services, covers skilled nursing facility coinsurance starting at day 21, covers your hospital inpatient deductible, covers foreign travel emergency. It has an additional benefit called Part B excess. What that means is basically that refers to how Medicare doctors get paid. And when you are receiving Part B services, office visits from your medical doctors, there are basically 2 ways doctors can choose to participate with Medicare. And they're called assigned or unassigned. Basically, the way that works is if you have, say, an appointment to see your primary doctor for just a regular office visit, and that doctor takes a Medicare assignment. This is how it works. So you go to your doctor for your office visit. That doctor would charge normally to anybody walking off the street without any insurance whatsoever. That doctor would charge $300 for that office visit. So when you go for your office visit, that doctor is going to bill Medicare $300. That's his regular rate. When Medicare gets that bill, they're going to turn around and they're going to assign $100 to that visit. They're going to pay 80% of what they assign. They're going to send the balance to your supplement. The supplement is going to pay the other 20% of that $100. the doctor is going to get paid a total of $100. Medicare is going to pay that doctor directly. The supplement will pay that doctor directly. He'll get paid a total of $100. Even though he billed Medicare $300, he knew he was only going to get $100 because Medicare already has a predetermined set dollar amount for any and every service you could ever receive. So he knew he was going to get $100. He knew Medicare was only going to pay him 80% of that $100, and then the supplement would pay the rest. That doctor accepts Medicare assignment, meaning he accepts whatever dollar amount Medicare assigns for his services as payment in full. Then there are doctors that don't accept assignment. It basically works the same way. You go for a regular office visit. That doctor is going to bill Medicare his standard rate of $300. Medicare is still going to turn around and assign $100 for that service and pay 80%. The difference is when a doctor does not accept assignment, that doctor is allowed to charge you, the patient, 15% above and beyond what Medicare assigns. So again, Medicare has already got a predetermined dollar amount for every service you could receive. So he knows he can charge $15 more than the $100 Medicare assigns. So he's going to ask you, the patient, to pay $115 before you leave the office. When he bills Medicare and Medicare assigns that $100 balance or that $100 amount to that service and pays 80%, Medicare is going to see that that doctor does not accept assignment. And Medicare is going to assume you've already paid that doctor $115 up front. So when Medicare processes the claim, they're going to send you a check for $80. They're going to forward the balance of $20 to your supplement. The supplement's going to send you a check for $20. If you have a supplement plan that covers Part B excess, that supplement will also reimburse you the extra $15 you paid upfront, so that you are reimbursed every amount, every dollar that you paid that doctor at the time of service. That doctor does not accept assignment, so he's allowed to charge you more, 15% more than what Medicare allows for any service, and he's allowed to ask you to pay that upfront, knowing that Medicare will reimburse you directly once he bills Medicare. They are required to bill Medicare. By law, they have to bill Medicare for you for those services, but they can also ask you to pay that balance up front, and Medicare will reimburse you, and the supplement will reimburse you directly. Honestly, there's not a ton of doctors out there that don't accept assignment, but there are some, and there is a doctors group in town that does not accept assignment. That could be more common or more prevalent in other areas, but in Colorado Springs, metro area, it's not very common, but it is good to know, because if you happen to find yourself in another state or another area, that might be something you need to be aware of. But again, Plan G, that includes that benefit, it is the only plan that includes that benefit for all intents and purposes, is considered the Cadillac level of coverage for Medicare supplements. If we move over to plans K and L, you'll notice that plans K and L pay benefits after Medicare at 50 or 75%. So Plan K will only pay 50% of whatever balance Medicare left over for Part B services, for hospital deductible, and for skilled facility. Plan L pays 75% of those benefits after Medicare paid first for outpatient Part B services, hospital stays, and skilled facility coinsurance. Because those plans pay less than 100% of what Medicare left over, they are much less costly in premium, and they do have maximum out-of-pocket limits, meaning if you have a really, really bad health year and you are doctoring a lot or having a lot of hospital stays, the most you would have to pay in that 50% or 25% balance that's left over after Medicare and the supplement pay their part. If you hit that maximum annual out-of-pocket, then the plan would have to pay 100% after Medicare for the rest of the calendar year. Honestly, in a really bad year, it would be difficult to meet these max out-of-pockets, because again, you'd only be paying either 50% of the 20% or 25% of the 20%. for most services. So it might be difficult to reach the $6,940 limit for Plan K or the $3,470 limit for Plan L. But again, the premiums for these plans are much lower. We move over to Plan M as in Mary. It pays 100% for Part B services. It pays 100% for your skilled facility coinsurance, that $200 a day, but it only pays half of your hospital deductible. And that's all the benefit it covers after Medicare. And then the last plan option to look at or level of coverage to look at is going to be Plan N as in Nancy. This plan is actually becoming pretty popular for some reason. This plan pays 100% after Medicare for Part B services for everything except for office visits. They will pay everything except $20. And emergency room visits. They'll pay everything except $50, kind of like a copay. But they do pay 100% for skilled facility coinsurance, and they do pay 100% for hospital deductibles. Now the four plans, the D, G, M, and N, that include the foreign travel emergency benefit. Honestly, I hesitate to call it a benefit because it's more of a reimbursement. The way that works is if you travel to a foreign country and you have a medical emergency while you're in that foreign country, basically you have to pay for that medical emergency while you're there. But once you got back home, you could submit that bill or that receipt to your supplement. First thing they're going to do is deny and suggest that you have to bill Medicare first because Medicare is your primary insurance. So you'd have to turn around and submit that bill or that receipt to Medicare. Medicare is going to deny because you were in a foreign country, you were outside of the United States. But once you get that Medicare denial, you submit the bill and receipt and the Medicare denial to your supplement. And after a $250 deductible, they will reimburse you, I believe, 80% of the cost of that medical emergency. So again, it's not travel insurance, but it is reimbursement if you have a medical emergency in a foreign country. Honestly, my best advice has always been, if you're going to travel outside of the country, I encourage you to purchase travel insurance. And I encourage you to purchase travel insurance that pays at the time of need. Because there is also travel insurance out there that would actually require the same process. You get back home and you ask for reimbursement versus paying at the time of need. Just a little tip there. So these are your levels of coverage that you have to choose from as far as how good of supplement insurance you want to go with your A and B of Medicare. There are two additional plans that I skipped over, Plan C and F. They're grayed out. Those two plans are only available to people who were initially eligible, whether you enrolled in Medicare at that time or not. If you were eligible for Medicare prior to January 1st of 2020, you would have the option of looking at Plan C and Plan F, the two I didn't talk about. But if you don't fall under that, if you don't become eligible for Medicare until sometime after January 1st of 2020, those two plans are not options for you. The only difference between those two plans and the rest of the plans that we talked about, or their current equivalents, D and G, is that C and F actually covered the annual Part B deductible on top of the other benefits. The reason these plans are no longer available for most people, especially anybody who becomes Medicare eligible after 2020, is because they covered the Part B annual deductible. That was considered basically too good of coverage because it was considered first dollar coverage after Medicare. And so they were discontinued, except for people who were eligible prior to 2020. So any questions? I know that was a lot. Any questions about any of that? I do see a question in the chat. Oh, go ahead.
You said that Part G was like the Cadillac of
Plan G
supplements. Yes. Now, if we have the Advantage plan, what is the difference in cost? Or what is the cost for Plan G? What is an average cost? Do you know that?
So that's what we're going to look at in the next slide, and that's
okay.
what I provided in one of the handouts that I emailed to everybody before today's presentation. is
Or I
a handout.
apologize.
Oh,
Okay.
that's okay. That's okay. That's a good question. That's why we're going to talk about it.
Okay, great. Okay, I'll wait then. Till we
All
get to
right.
that part. Thank you.
Uh-huh. And then I do have a question in the chat. Assume I enroll with an insurance company for a Medigap plan, say Plan G, during initial enrollment. If I change to a different Medigap plan with the same insurance company after 6-month window, is that subject to underwriting? That's a good question. So that 6 months of guarantee issue, that 6-month window, nobody can underwrite you at any time for any reason. So you can switch from one company to another every month for 6 months without question. You can switch from one level of coverage to another without question during that 6 months. Once that 6-month window expires, even if you only want to switch to a different level of coverage within the same company, you could be subject to underwriting. So unfortunately, the answer to that is yes. So because of that, I do encourage people to look at purchasing the most comprehensive level of coverage that you can afford, because this is the kind of insurance that you're probably going to want to look at in long term, the kind of coverage that you're not going to want to have to worry about changing ever. So you want to make sure you get the best level of coverage you can afford, so that even if you don't use it now because you're healthy, if and when something happens in the future, you know you have good coverage. You have the best coverage that you can get. So yeah, this is not the kind of coverage that you will have an annual opportunity or an open enrollment period to change. There is no annual window of enrollment for this kind of insurance. So all those open enrollment periods that we're going to talk about do not apply to this kind of insurance. Once you're in, you're in, and they can never drop you for any reason other than non-payment of premium. But once you're out and have developed any sort of pre-existing health issue, you could be out, because in most cases you would be subject to underwriting, with a few exceptions such as other involuntary loss of coverage. Also, if you are, say you enroll in a supplement plan with company X, and 5 years down the road, company X goes out of business and you lose that policy, that would again be considered involuntary loss. It wasn't your fault. And Medicare would provide you with a window of opportunity to be guaranteed issue into any other company at that level of coverage, because you involuntarily lost your existing coverage. So Medicare really does work hard to make sure that people are not put in a position where they're uninsured through no fault of their own and uninsurable. So even in a situation like that, anytime you lose coverage through no fault of your own, you will have an opportunity to get something else to replace it. Okay, so hopefully that answered your question. The other handout that I included in the email that I sent you was this multi-page handout. It says Medicare supplement insurance policies in Colorado. It is dated September of 2022, but it is the most current document. This handout is actually put together for us by the Division of Insurance up in Denver. In Colorado, we are very, very lucky that they do this for us, because not every state does. But they take the time and energy to contact all the companies licensed to sell this kind of coverage in Colorado. There are over 40 companies licensed to sell this kind of coverage in Colorado. So they contact those companies and get updated information, but they can only do it once a year. So the information in this handout, honestly, is not going to be accurate to the date. It's going to be averaged. It's going to be averaged based on a Denver zip code, but it's going to give you an idea of what you're looking at for costs. So again, this is about an 8-page handout, 8 or 10-page handout. The first half of this handout is basically going to give you brief paragraphs about everything I just talked about. Guarantee issue, underwriting, that kind of stuff. Halfway through the document, you are going to get to this page. This is the first chart that you're going to see. If you'll notice on this chart, at the very top in little tiny writing, it will say age 65. Along the left-hand side of the page, down the page, it will list all of the companies licensed to sell this kind of insurance in Colorado in alphabetical order from front to back. So it's 2 pages for each age group. It'll say A through N across the top, just like the chart we just looked at, this one. And these are going to represent the different plan levels that we just talked about. If you intersect Plan G, for example, so you go to Plan G, you go down that column, and you intersect it with a company that you're interested in looking at. On this handout, we're going to look at, say, let's look at Physicians Life. So if you find Physicians Life, you go across to the column where Plan G is, where those two intersect. If there's a number in the box, that number does represent an approximate monthly premium for that plan with that company at that age group. I say approximate because, again, these premiums were gathered in September of last year. Most companies will tend to have a premium increase around the first of the year, if nothing else. And these premiums were averaged in a Denver zip code of 80202. Denver does tend to pay slightly higher premiums than we do in Colorado Springs or El Paso County. But the prices you see here are going to be in the ballpark. What that means is the whole point of this handout is basically to show you what companies charge more, what companies charge less for the same product. Because again, these plans are set in stone. Every company sells exactly what's on this chart as it's laid out. A Plan G is a Plan G is a Plan G, no matter who you buy it from. Plan N is a Plan N is a Plan N, no matter who you buy it from. They're all selling you the exact same thing, based on whatever plan you decide to look at. So it does pay to shop around, because there is really not any advantage to paying a higher premium for, say, a Plan G when another company will sell it for a lower premium. You're not getting anything extra. You're not getting better service. You're not getting better coverage. So this is going to help you determine what companies you might actually want to talk to get this kind of insurance. Because if you go down this list, down any one of these columns that are filled with numbers, you will see that prices can vary quite a bit from one company to another. And again, these companies have so many different variables that they factor in when they're deciding what premiums they're going to charge. I don't even want to know them all, but I can tell you zip code, age, whether you're male or female. Honestly, women tend to pay lower premiums because statistically we take better care of ourselves. Smoking or non-smoking, that kind of stuff are all going to factor in. Also, between the A through the N and the insurance company's names and numbers, there's also a column that says notes. Those notes are going to tell you, and there's a key code on the page just prior to these charts that tell you what all of these note codes mean. But some companies will provide household discounts. So if a husband and wife get the same coverage through the same company, you could get a discount on your premiums. Multi-policy discounts if you have insurance with a company for other kinds of coverage, such as auto or home, you could get a discount. It's going to tell you whether or not they charge an application fee. Unfortunately, I'm seeing application fees become a little more prevalent as time has gone on. I don't get why someone would charge an application fee. I don't necessarily think you should have to pay an application fee, but some companies will charge it. So all of those kinds of things that the companies factor in are going to be in the key codes page just prior to these charts. Let me look at this question. Is there any quantitative info that shows the history of rate increases for these companies? So that is another good question. These companies, just like with any other kind of insurance we may ever have to have, these companies will raise their premiums. That's just how it works. Premiums are going to go up on an annual basis. Average rate increases for these kinds of plans across the board, 6 to 15% annually. So that's something you would want to take into consideration budget for. However, there have been situations in the past where companies have a higher increase jump from one year to the next. What you should know is that all of these companies are required to submit any rate increase to the Division of Insurance for approval before they can actually impose that rate increase. So the Division of Insurance vets and has to approve rate increases. And if they have a significant rate increase higher than the 6 to 15%, it has to be justified to the Division of Insurance. Does that mean that they're not ever allowed to have a higher rate increase? Sure they are, if they can justify it. If you are looking to see if there's a history of what kinds of rate increases company has from year to year, on the previous page where the notes, the key code notes are, there's also information about how to research the financial stability of these companies through the AM Best and the S&P websites, where you can kind of look at that information. Excuse me. What I would encourage you to do when you're looking at these companies and you're starting to make phone calls to get exact premium quotes, because unfortunately you probably will have to call these companies. And again, this handout is hopefully going to help you narrow down the number of companies you would bother calling. But you will probably have to call these companies to get an exact price quote for you and your zip code. During that call, I would encourage you to ask them what kind of premium increases they've had over the last 5 years, and see if they can even tell you that. You could also, and hopefully they would tell you that, but you never know. You could also contact the Division of Insurance up in Denver, and they should have that information available for you because they're the ones that approve those rate increases. And as SHIP counselors, as Medicare counselors, we also have access to a database that is updated on a daily basis. Whereas if you contact us and ask us if we can provide current that day premiums for these plans, we can go into that database and get you a more specific price quote for any of these plans with any of these companies. And we're happy to do that at any time. So hopefully that answers that question, probably more than you wanted, but are there any other questions about any of that?
Can you hear me?
Yep, go ahead.
So what is, and I hope I'm not jumping the gun again. What are the differences? Let's say like my husband has the Advantage plan.
Mm-hmm.
What's the difference between the Advantage plan and the Plan G, the Cadillac one?
So for example, on average across the board, for Plan G, you're going to be looking at about $130 for someone who's just turning 65.
Right.
And that's per month per person.
I meant as far as the coverage, the difference in what each of those cover. Is there a big difference between the Advantage plan and Part G?
Well, no, the Advantage plans basically are going to cover everything Medicare covers. Supplements cover everything Medicare covers. Because again, supplements only pay if Medicare paid first.
Right. Okay.
So the bottom line is, no matter what direction you go in, if it's covered by Medicare, it's covered. The difference is you pay $130 a month premium for this kind of insurance so that when you need services down the road, you pay nothing. Your insurance pays it all.
Right. Okay. So it pretty much covers anything we would need if we have the Advantage plan plus the G, the Cadillac.
Well, you can't have both. You can only have one or the other.
Oh, okay.
And that's the kicker.
Which one's better? I mean, really,
that's what I can't tell you, but we are going to talk about Medigap or Medicare Advantage plans in detail next. So hopefully that'll help you understand it.
Okay, thank you.
You're welcome. All right. I see I'm running a little bit behind. So Any other questions about Medigap? That's Medicare supplement, Medigap coverage in a nutshell. All right. So now let's talk about the other direction. The other option you have for coverage to go with your Medicare, which are of course going to be Medicare Advantage plans, sometimes referred to as Medicare Part C, although honestly, it's not technically a part of Medicare. So this kind of insurance is an entirely different kind of animal. It works entirely different than original Medicare with a Medicare supplement. One last note on Medicare supplement coverage. Again, when you have original Medicare A and B, that is your primary insurance. The supplement is your secondary insurance because it pays the balance after Medicare pays first. Supplements do not come with drug coverage. You have to purchase that separately in addition to the supplement policy. So just keep that in mind. Medicare Advantage plans, again, entirely different animal. Medicare Advantage plans are also insurance options that are offered by private insurance companies. The difference is that these private insurance companies contract directly with Medicare. And what that means is when they contract with Medicare, Medicare pays these companies a flat monthly fee for every person that enrolls in their Advantage plan. That's how they get paid. And with that flat monthly fee that they get for every person they enroll, they are responsible to pay for all Medicare covered services. So when you enroll in an Advantage plan, you're actually enrolling in a policy that is controlled by a private insurance company. These companies are required by law, by regulation, to provide any and all services that Medicare covers in every way that Medicare covers it. They cannot decide that even if it would be covered by Medicare, they're not going to pay for it because they don't have to. Anything and everything that Medicare would ever cover, these companies have to cover. But again, all of those services would go through the insurance company, not Medicare. You still have original Medicare when you enroll in an Advantage plan. You still have to pay your Medicare premium. Can't get out of that. But these plans are also sometimes referred to as replacement plans because they replace. They are acting as your Medicare A and B once you're enrolled in a plan like this. You still have all your Medicare rights and protections. You still have all the covered services of original Medicare, but these are called Advantage plans for a reason. And that's because they may include extra benefits that are not typically going to be covered by Medicare or original Medicare, and they tend to be much lower in premium. Most Advantage plans will also come with Medicare drug coverage or Part D coverage at no extra cost. It's included in the package. So let's dig down into that a little bit more. There are some additional requirements to enroll in an Advantage plan, meaning primarily you have to enroll in an Advantage plan that's available in the county you live in, also referred to as the plan service area. There are different Advantage plans to choose from in every county. So the plans that are available in El Paso County are going to be different than the plans that are available in Teller County. Whatever county is your county of residence, you have to pick a plan from that county. Again, you must be enrolled in both A and B of Medicare to enroll in an Advantage plan. And there are enrollment periods that you need to be aware of. And you can only make changes during these enrollment periods. And we're going to talk about that in detail. So when it comes to Advantage plans and Part D plans, there are multiple enrollment periods you need to be aware of. There's the initial enrollment period, and that is going to be the same enrollment period as when you are first becoming eligible for Medicare. It is going to be that 7-month window, 3 months prior to the month of your birthday, the month of, and 3 months after the month of your birthday. That's your enrollment period into Medicare. That's your initial enrollment period for an Advantage plan. And then there are additional enrollment periods. Sorry about that. There are additional enrollment periods. There are the annual enrollment period, what we tend to refer to simply as open enrollment. There is a new enrollment period that just went into effect a few years ago, specifically for Medicare Advantage plans. And then, like I mentioned before, there's always exceptions to the rules. So there are special enrollment periods that you might be able to make a plan change or get into or out of a Medicare Advantage plan. So the annual enrollment period or annual election period, again, we simply refer to that as open enrollment every year. That is the October 15th through December 7th window every fall, where you have an opportunity to either get into, get out of, or switch from one Advantage plan or Part D plan to another. Any change that you make during that October 15th through December 7th window goes into effect January 1st of the next year. This happens every year. Everybody gets to take advantage of it. And then a few years ago, like I mentioned, Medicare initiated this newest enrollment period. It's called the Medicare Advantage Open Enrollment Period. This period only applies to people who are officially enrolled in an Advantage plan on January 1st of any year. So if you are enrolled in a plan on January 1st, you are provided another 3-month window of opportunity to either change to a different Advantage plan or get out of Advantage plans altogether. So this gives you another 3-month opportunity. So say you enrolled in an Advantage plan for the first time ever during open enrollment in the fall, and that Advantage plan goes into effect January 1st. But by January 1st, you've had some second thoughts. You decide maybe that's not the right plan for you. Between January 1st and March 31st, you can switch to something else. Or again, you can get out of Advantage plans altogether and just go back to original Medicare. If you're not in an Advantage plan on January 1st, this enrollment period has nothing for you. Doesn't apply to you at all. And then special enrollment periods. Special enrollment periods there are a lot of different ways a special enrollment period could affect somebody with an Advantage plan. One of the things to remember about Advantage plans, again, you can only purchase a plan that is available to enroll in the county that you live in. And typically they're only going to be usable in the county that you live in outside of a medical emergency. What that means is if you're in an Advantage plan and you move from one county to another, you can't take your plan with you either. It stays in the county you bought it in. But because you can't take it with you if you make a move, Medicare does consider that involuntary loss. It wasn't your fault, you can't take it with you. What that provides in that situation is it gives you a window of opportunity, or when you get to where you're moving to either get into an Advantage plan available in the area that you move to, or it gives you a 60-day window of opportunity to be guaranteed issue to a supplement. The other way that could happen is if you're an Advantage plan and that Advantage plan decides to leave the county you live in. They're just going to pull out completely. They're not making any money. They're hitting the road. Again, that's involuntary loss of coverage. It wasn't your fault. And that provides you a window of opportunity to either get into a different Advantage plan that is available in your area or have guarantee issue into a Medicare supplement. Another way you could have a special enrollment period is called a test drive or a trial right. When Medicare Advantage plans kind of exploded onto the market in the last 5 or 6 years, because prior to the last 5 or 6 years, there was only a handful of Advantage plans to choose from. As of today, there are 27 in El Paso County alone. So they exploded onto the market about 5 or 6 years ago. Unfortunately, what that did is create a lot of confusion. And there are a lot of people out there that are not quite sure how these plans work, which is why we're talking about it today. Unfortunately, there are also a lot of insurance agents and brokers out there who are selling people these plans, and they aren't quite sure how they work, or they're not divulging enough information to people before they're enrolled so that people understand what they're getting into. And that became a really, really big problem. So such a big problem that Medicare actually had to step in and do something about it, because people were getting enrolled in plans that they did not want to be enrolled in, should not have been enrolled in, did not know they were being enrolled in. So what Medicare decided to do was create a test drive opportunity. What that means is that people who are trying out an Advantage plan for the very first time get a test drive. So if you become eligible for Medicare, if you enroll in an Advantage plan from day one, Medicare is going to let you test drive it for up to 12 months. If at any point within that 12 months from when you enrolled, you decide that that is not the kind of insurance for you, you can drop that Advantage plan. Even though it's not an enrollment period, you can drop it and still have guarantee issue into a Medicare supplement. In a way, it also extends the guarantee issue into a Medicare supplement from 6 months to almost 12 months because of this test drive. But it only works if you enroll in an Advantage plan when you enroll in Medicare. If you like Advantage plans and you are in that Advantage plan for longer than 12 months, your test drive expires and you would be subject to underwriting if you try to get a Medicare supplement under other situations down the road. So you get a 12-month test drive to test it out when you first get Medicare, but you can also use a test drive down the road if, when you first get Medicare, you enroll in a supplement and you maintain that supplement without any break in coverage for however long you do so. And then 1 year, you just decide you're going to try the Advantage plan. You want to see what it's all about. You want to see what all the hype is. You'd be allowed to drop your supplement and enroll in the Advantage plan during an enrollment period, the open enrollment period in the fall, and get 12 months to test it out, to try it out. And if at any point during that 12-month period, you decide it's not for you, you want your supplement back, you'd be allowed to drop the Advantage plan and be guaranteed issue back into the supplement you dropped. The key to that test drive is you have to maintain that supplement coverage without any breaks from the time you get Medicare to the time you do the test drive. So those are some ways that you can try out Advantage plans without being committed to them forever. And this could be especially important for people who might have some health issues that are really, really wanting to try Advantage plans, but are not sure they should. This gives you that opportunity to try them out without losing or risking your guarantee issue. And in some cases, it actually extends your guarantee issue into a supplement. So keep that in mind. Any questions about any of that so far? Go ahead.
If you are on the Advantage plan and you want to drop it and let's say go to plan G, and it's been more than a year, are you subject to underwriting at that point?
Yes, you are.
Okay.
Yes.
All right.
Yep.
Okay. All right.
Okay.
Thank you.
You're welcome. Any other questions? Okay. So again, these plans work differently than Medicare and a supplement. Let's see. Okay, well, let me take this question in the chat. Does the test drive apply to Advantage plans offered by a group plan, such as Para? That is a good question as well. And the answer is no, but that is because, for example, Para specifically, what Para offers their retirees with Medicare implies that it's an Advantage plan, but it's technically not. It is a retiree plan that works differently than the plans I'm talking about tonight. Also, when you have a retiree health benefit, if you drop it or it drops you for whatever reason, because you've been in a retiree health benefit that's considered creditable, you automatically get a guarantee into a supplement or an advantage plan due to that loss of retiree coverage. So it's kind of apples and oranges. You get the same opportunities, but for different reasons. And if you wanted to talk about more specifically how that affects a para retiree, we're happy to sit down and talk to you about that. We deal with a lot of para retirees, so we're pretty comfortable with how all of that works and are happy to talk to you about that. Any other questions? Okay. So again, these plans work differently than original Medicare with a supplement. Again, you still must pay your Part B premium. Nobody gets out of that. Everybody has to pay that no matter what. On the plus side, these plans, in most cases, and I can tell you probably 95% of the plans in El Paso County have 0 monthly premium. No premium. And if it does have a premium, that premium is going to be much lower than that of a Medicare supplement. $40 to $60 on average. But most Advantage plans in El Paso County, 0 premium. Again, most of them will also include Part D drug coverage included in the package. But in exchange for that, you will have out-of-pocket costs for most services in the form of copays. So let's talk about how that works a little bit more. Again, you're going to get any and all Medicare covered services, but you get it through the plan instead of directly through Medicare. These plans will most of the time include prescription Part D coverage, but you may be limited to what providers you can see, what hospitals you can go to, because a lot of these plans will have networks of providers they want you to use. The exception to that rule is in a medical emergency or urgent need. Anywhere in this country, the plan has to cover you no matter what. And benefits and cost sharing work differently than that with original Medicare. And then just to make it a little more exciting, there are a lot of different kinds of Advantage plans, and they all work slightly differently. There are HMOs, PPOs, private fee-for-service plans, special needs plans, and just this last year, some of these plans have created hybrid options, point of service option added to some of these plans. There are also Medicare savings account plans, although we don't have any in Colorado right now. We don't currently have any pilot or demonstration programs going on in Colorado, but we do have PACE programs, or programs for all-inclusive care of the elderly. If you need or want a complete list of all the plans available in all the areas of Colorado, the best way to get that at an all-in-one option would be to, again, pick up the phone and call 1-800-MEDICARE and ask them to mail you a Colorado-specific Medicare and You handbook. And in the back of that book, it lists all the plans and the areas that those plans serve. So let's talk about what the different plans do. Again, there are different kinds of plans. We're going to start with Medicare HMOs, or Health Maintenance Organizations. If you've ever had an HMO through work, through school, through whatever, if you've ever had an HMO, you know what I mean when I say an HMO is an HMO. HMOs all work exactly the same. What that means is HMOs have networks of providers and facilities that they require you use. You are not allowed to use facilities and providers outside of their network of contracted providers and facilities. Again, in most cases, a network is going to be the equivalent of a service area. A service area is the equivalent of the county of residence that you live in. In HMOs, you are usually required to get a referral to see specialists or other types of doctors. You could be required to get prior authorization for some services. If you go out of network for services, the plan is not going to pay anything. And in this case, Medicare will not pay anything. In an HMO, you have to follow their rules. But HMOs will always come with drug coverage. PPOs are similar to HMOs in that they have a network of providers and facilities they would prefer that you use. but you're not limited to that network of providers and facilities. So in PPOs, they have a network that they contract with, they prefer you use that network. If you choose to go out of network to see a doctor that doesn't participate with the PPO, you would be allowed to do that. But it would be your job to make sure that whatever doctor you want to see that's not in network will take your insurance. So they have to agree to take your insurance in order for you to see them for services. If they decide they don't want to take your insurance, they don't have to. But that becomes your job to find out. Because you're allowed to go out of network, these types of plans typically will not require referrals to see specialists or other types of providers, but you may still be required to get prior authorization for some services. If you go out of network and find a provider that will accept your insurance, keep in mind that you will pay more out of pocket or a higher copay to see an out-of-network provider than you would if you stayed in network. PPO plans may or may not come with drug coverage. If a plan does not come with drug coverage, you would have to have a good reason why you don't need drug coverage from Medicare, because you would not be allowed to purchase a Part D plan separately. For example, if you are a veteran and you have access to the VA pharmacy, you may not need an Advantage plan that includes drug coverage because you have access to VA pharmacy. Private fee-for-service plans were originally designed to have no network. They were designed to provide the most freedom for you to go wherever you wanted to go. Unfortunately, there were a lot of agents out there selling these types of plans to people in areas where no doctors would take them, period. So again, Medicare had to step in and now require that these types of plans, these fee-for-service plans, contract at least one provider in every county that they are available in, so that there's somebody you can see. But because there is no network, honestly, you can see anybody who is willing to take your plan, meaning they're willing to take whatever the plan pays them plus your copay as payment in full. On the other hand, because they are not contracted or not part of a network, the providers that you see that will agree to take your plan can agree to take that plan one visit, but decide not to take that plan if you try and have a second visit. There is nothing that says they have to take you, and they can decide that on a case-by-case basis. But again, it becomes your responsibility to make sure that you can find providers that are willing to take your plan. These plans may or may not also come with Part D coverage, but if you get a fee-for-service plan without drug coverage, you would be allowed to buy a Part D plan separately. Special needs plans are basically Medicare HMOs, but for very specific populations, such as people who are Medicare with Medicaid, or who reside in certain facilities, or who have qualifying chronic health conditions. Not available in all areas of Colorado. And if anybody wanted more information about these kinds of plans, you're welcome to call us or 1-800-Medicare, and we're happy to talk to you about them in more depth. Basically, they're going to be HMO, Medicare HMOs with less out-of-pocket cost in most cases. PACE program is a customized Advantage plan, works very much like an HMO also. It is also for a very specific population of people who are Medicare and would qualify for long-term care Medicaid. Wouldn't necessarily have to be on Medicaid, but would at least have to qualify for Medicaid. PACE programs are designed to be more hands-on as far as managing someone's healthcare, because this kind of program is designed to provide additional social services that help people stay in their homes longer versus having to go into a long-term care facility. So again, if anybody wants more information about this kind of program, you're welcome to call us or 1-800-Medicare, and we're happy to talk to you about that. Very limited service area for these kinds of plans basically is going to be available in the I-25 corridor with the urban metro areas. All right, I'll pause real quick to see if there are any questions about that. No questions? Now, this is a lot of information. I appreciate your guys' patience tonight. We're almost done, I hope. All right, so moving on. In an Advantage plan, you do have rights, additional rights than original Medicare. You have a right to make sure that you always have access to healthcare providers through the plans. You have a right to know how these plans providers get paid. You always have a right to fair, efficient, and timely appeals processes if you don't agree with a decision a plan makes about your coverage, or expedited appeals decisions in certain types of healthcare settings. You always have the right to get the care that you need. The plan is responsible for providing whatever care that you need. You have the right to get information about your plan in easy to understand language. And of course, you always have the right to have your medical information kept private. Again, I mentioned earlier that when these kinds of plans exploded onto the market, there was a lot of misinformation, a lot of misunderstanding. Medicare has had to make a lot of rules about how these plans are marketed. I'm sure all of you have seen at least one commercial, probably dozens of commercials marketing Advantage plans, whether it's a commercial with J.J. Walker or Joe Namath, or just a 1-800 number. All of those commercials are basically talking about Medicare Advantage plans. But there are a lot of ways that these plans, these insurance companies, are not allowed to market to you. So real quick, let's go down the list. For marketing purposes, insurance agents, brokers, representatives, companies. They are not allowed to approach you in common areas, such as parking lots, streets, sidewalks, hallways, lobbies. They are not allowed to approach you. If an insurance agent or broker has a table set up with their health plan information on it for you to look at, you are allowed to approach them and ask questions, but they are not allowed to walk away from the table and approach you to see if you want information. They are not allowed to send you unsolicited texts or make unsolicited calls, cold calls. However, they are allowed to send you junk mail through the email. They're allowed to send you junk mail through the mailbox. Emails must have an opt-out option embedded in that email so that you can hit opt-out and never get an email from that company again. Phone calls, that's kind of a gray area, because if you have ever had a relationship with any company ever, say you had car insurance with company X 20 years ago, and somehow your name is still on their books, and now that company sells Advantage plans. If they call you and solicit our market for an Advantage plan, it's not considered a cold call, because at some point in history you had a relationship with that company. So that becomes a pretty gray area. But if you do believe you're getting unsolicited calls from companies you never had a relationship with, we do encourage you to speak up, give us a call, give Medicare a call, give someone a call, and let them know that you're getting those calls. Agents, brokers, and companies are not allowed to use the term free to describe zero premium plans. Nothing is free. There is zero premium, but that's not free. They cannot require that you provide your contact information if you attend a marketing event with any broker, agent, or company. Meaning, if you want to go to a Medicare 101 that someone's hosting at the library, they cannot require you sign in. You do not have to sign in. You do not have to give anybody your name or contact information unless you choose to do so, but they cannot make it a requirement. And they cannot camp out in doctor's offices or medical providers' offices, and doctors shouldn't be allowing them to do that. They cannot misrepresent themselves as working for Medicare or Social Security or the government in any way. They cannot conduct marketing events at the same time as they're doing an educational event. What that means is if you got a postcard in the mail to attend a free Medicare 101, and you go to that 101 and they're not giving you a Medicare 101, which is what I'm doing, they're trying to sell you what they sell, that's a no-no. What they can do is if you get that postcard, you sign up for that 101, you go to it, it's an actual 101 where they're not selling you what they represent, they're just giving you information. As soon as you walk out the door of that event, they can have a table set up with marketing materials and you can approach them to get more information. But even in that situation, they're not allowed to come to you. You have to go to them. They're not allowed to buy you dinner or lunch, basically. At an event, they can provide snacks and refreshments. They can't offer any incentive items or free services that are worth more than $15 per person. And they would have to offer that to anybody who comes to that event, regardless of whether or not someone enrolls in something. And they absolutely cannot go door to door, ever. That includes putting flyers or business cards or brochures at someone's door. They cannot do that. I have had situations where agents have gotten into a secure apartment building, a senior complex, and have literally knocked door to door just going down the hallway. That is a big no-no. Things they must do is these companies must submit all their marketing material or presentation material to Medicare directly for approval. So Medicare gets to vet everything and approve it before they are allowed to use it for marketing purposes. These companies must comply with do not call registries, however well you think that works. Agents and brokers must obtain your permission to contact you, usually in writing or verbal recording, that says, yes, I want someone to come talk to me about what they are selling. If you have that appointment that you initiated and you said, yes, come and talk to me, when they come and talk to you, they must have you sign a piece of paper called a scope of appointment that says and explains to you that you understand that during that appointment, that person can only talk to you about the product that you asked them to come and talk to you about. If that agent or broker sells other products, such as drug plans or supplements or annuities or any other kind of product, even if you want additional information about other products they sell, they would not be able to talk to you about those other products until the end of the appointment where they're talking to you about Advantage plans. Then you would sign another scope of appointment that allows them to talk to you about an additional product. There is more information about all of that in one of the handouts that I did send you in an email earlier. If you have any questions about any of that, feel free to call me or shoot me an email. We're happy to talk to you about that. I make a point of going through this information because it is so important. If you think you are witnessing, have experienced, or otherwise any of the things that they're not supposed to do, and honestly, these 2 pages are a short list. These are the most common things that become issues, but this is not everything that they can't do. If you think you have come across any situation that these things are happening, please speak up. Please call us, call Medicare, talk to somebody and let them know. If these things are not being reported and agents and brokers are doing them and getting away with it, it does cause real harm to people who get enrolled in plans that they shouldn't be enrolled in, or in things that they don't realize how they work. So ignorance is not bliss when it comes to this kind of coverage. So please, if you see something, even if you're not sure, give us a call. We'll talk it over with you. We'll figure it out if it's something that is above board or not. And if it's not, we'll help you file a complaint with Medicare. It's a simple phone call, and Medicare wants to know. Medicare is looking very, very closely at all of these marketing practices right now. They want to know everything, and they are looking at every individual complaint that somebody submits. And again, we're happy to help you do that. All right, so that is basically Advantage plans in a nutshell. Questions you should ask yourself when you're looking at this kind of coverage. Because most of these plans include drug benefits, please make sure that your specific drugs are covered by whatever plan you're looking at. Every plan that includes a drug benefit and every drug plan that's just drug benefits, they all have different lists of drugs that they will cover, called formularies. And we're going to talk about this next week in more detail, but every plan covers a different list of drugs. You want to make sure your specific drugs are on that plan's list. If you have doctors that you've been seeing for years and years. You do not want to change or lose them. Ask those doctors if they take any of the plans you're looking at. If you enroll in a plan without checking with your doctors, those doctors do not participate. You can't see those doctors anymore without having to pay the full thing out of pocket. If you doctor a lot or have health issues that require that you see specialists a lot, keep in mind HMOs in particular require that you get a referral from your primary doctor to see the specialist every time. And you could be potentially looking at 2 copays for the 1 visit to the specialist you needed. And then whatever other things you want to know. Now, I didn't talk a lot about the extra benefits that these plans may offer, so let's chat about that for just a minute. The big selling point for most of these plans these days are the extras. Dental, vision, hearing services, free gym memberships. As time has gone on, these plans are allowed to offer more and more extras. Some plans offer transportation to a doctor's office. Some offer, meals delivered to your home after a hospital stay. Some offer to pay part of your Medicare Part B premium. That's the newest, biggest fandangle. Some of them offer what they call flex cards that provide basically cash benefit that you can use to pay whatever. Or they offer a pharmacy stipend that allows you to purchase pharmacy products through their catalog, $75 every 3 months or something like that. A lot of people hear the extras. They focus on the extras. They want the extras. All those extras are things that original Medicare does not offer. Be careful, is all I'm going to say. If you're getting those benefits through an Advantage plan, make sure you understand how those plans work and how to access those benefits through the Advantage plan you get. For example, dental. Dental is probably the #1 benefit I hear people want. It is not a benefit of original Medicare. So if you get dental through your Medicare, it's going to be an Advantage plan. Make sure you understand how to use that benefit. Advantage plans will typically have their own network of dentists they want you to go to. If you don't go to their network of dentists, they may not pay for those dental services. A lot of people are not realizing that and just assuming they can go to whatever dentist they want and the plan will pay for it. No, dentists may not participate or want to participate with Advantage plans. Advantage plans have usually providers they want you to go to. Same for hearing services, same for any of it. If there are those benefits that you consider a must-have with your Medicare coverage, make sure you understand how any of those plans would want you to access those benefits before you enroll. Don't just assume you know anything, ask lots of questions. Because if you enroll in a plan, assuming you know how you're going to get those benefits or they're just going to give them to you, and that doesn't happen, I get those calls. So I see it happen a lot. Ask lots of questions, especially about the benefits you think are important or you want to use. Another handout that I provided in the email is this Medicare Advantage plan options for Colorado consumers. I love this handout. It's a multi-page handout. It basically is going to give you a little bit more information about all the different types of Advantage plans that I just talked about. And it's going to give you the pros and cons of each of those options. Wonderful document, very, very helpful in understanding the different kinds of Advantage plans. And I will be updating this here soon. The other handout I gave you is this handout that we put together internally. I do it for El Paso, Park, and Teller counties right now. It is basically going to be an at a glance of all the Advantage plans available in El Paso County right now. It's going to list all the plans. It's going to tell you what kind of plan it is, HMO, PPO, etc. It's going to tell you if it has a premium, if it has deductibles. It's going to give you an average copay for most common services. It's going to tell you if it has a closed network or a national network. It's going to tell you if it offers any sort of Part B premium buyback or payback. I did not provide information about the extras because there are just too many of them. But again, you're always welcome to call us and sit down with a counselor, and we can go over your specific situation and look at all of the plans that are available to you on an individual basis. But this handout is nice to have. Again, this one is for El Paso County, but I also do them for Park and Teller County. And I will see if there are any questions. I do see a hand raised. So is it Tia? Did I say that right? If you have your hand raised, go ahead and unmute and ask your question.
How do you handle vision, dental, things of that nature if you're on original Medicare?
Good question. So again, those are not services that Medicare pays for. It's not a benefit of Medicare. You can get those services with however you choose to do so. Whether you go out and purchase a dental policy or dental vision policy, you go out and get a dental vision discount plan, you pay cash. A lot of dentists do internal financing. You can do things like care credit. Medicare doesn't care. It's not a benefit of Medicare. However, you can find the best deal to get those needs met is what you can do. I can tell you that the Colorado Marketplace, our Obamacare health market, does sell or does give you information about individual dental policies or dental and vision policies, and you can shop around through there. On average, you can buy a dental policy, an actual insurance policy, for, $25 to $40 a month. It's going to provide you with, the basic coverage, anywhere from $1,500 to, $3,000 or $4,000 a year in benefits. They're going to have hopefully pretty large dental networks. But however you want to get them is how you can get those benefits, because Medicare is not going to offer them or pay for them. They really don't care how you get them. But it does pay to shop around for those kinds of things. Vision benefits, if you can't find a vision policy or a dental vision policy combination, honestly, sometimes you get a better deal just waiting for one of the big box stores to have a good sale. So, I mean, it pays to look around at what options are out there for everybody else, or for things that insurance are simply not going to pay for. Wish I had a better answer. I wish I could say Medicare is going to pay for that. I've been doing this for 23 years. I have hope every year that Medicare will decide to cover dental. Hasn't happened yet, but I can still hope. I think it's in the near future, but it's not here now.
Thank you.
You're welcome. Okay. So any other questions? I know we're running way over time, so I'm going to try and let you go here soon. Star ratings. Let's see. So here's a question, the handout, which provides star ratings for the various plans. Are there similar star ratings available for Medigap? Unfortunately, there are not. If you go to the Medicare.gov website, they do list, I believe, and I rarely look at it because I don't think it's very helpful. They do list different companies, and they might apply a star rating through the Medicare website. But again, I don't think it's very helpful because it's not very good information. It's accurate information for what little information they give you, but they don't give you information specific to the companies that are available in a specific city or state. So Medicare may have some limited star rating information, but it's not going to be comprehensive like they do for the Advantage plans and drug plans. What I can tell you is, again, you can contact the financial websites, the A and B and the S&P, but that's really looking at the financial stability or the financial ratings is going to be your best ratings equivalent for that kind of information. You might be able to call the Division of Insurance and see what they have as far as if they have any sort of thing that rates the companies, but I really don't think they do. Because really the bottom line was that when it comes to Medigap, really there is no one that is better than the other, honestly. They all have to do exactly what they have to do based on the plan that you purchase, and they cannot deviate from that. They cannot deny a claim if Medicare paid their part. They cannot delay paying claims because Medicare bills them electronically. So they're like robots. They do what they're supposed to do because Medicare triggers them to do that, and that's all they can do. So I haven't had to call these companies or any of these companies about a customer service issue in literally almost 20 years. I've been doing this 23 years. When I started this job, I had to call them. Why didn't you pay this claim after Medicare? But then Medicare went to electronic billing where when a doctor bills Medicare, Medicare bills the supplement. So doctors don't even have to get involved in that billing process. It's all electronic. So it processes much quicker and there are no questions. If Medicare paid, they pay. So customer service becomes a moot point. I haven't had anybody complain about customer service with any of the companies that they've dealt with as far as Medicare supplements in a really, really long time. So I don't know if that answers your question, but hopefully it helps. And that's probably why Medicare doesn't have really star ratings for these kinds of companies or insurance, and the Division of Insurance probably won't either. So again, I hope that answered your question. Next question, is there ever underwriting when enrolling in Advantage plans? No. Advantage plans have to take you as long as you enroll during an opportunity of enrollment, whether it's initial, annual, Advantage plan, open enrollment. As long as you're enrolling during a qualifying period, they don't care what your health is like, they have to take you. No underwriting ever. But again, that's one of the reasons you have the annual opportunity to change plans, to get into, get out of, go from one to another, because there is no underwriting. And that's why you can't have that opportunity with a supplement, because they underwrite. So there's no annual enrollment opportunity with supplements. Once you're in, you're in. Once you're out, if you have health issues, you could be out. But Advantage plans or Part D plans, no restrictions of any kind. Any other questions? We are almost done, I promise. I might even skip these slides. All right, I don't see any other questions. I'm not hearing any other questions. So let's see. So I did talk briefly last week about Medicare savings programs. These are programs that are designed to help cover some of the costs of Medicare for people who have lower limited income. These are the income, pre-deduction income limits per month for single people and married couples, and the asset limits. Again, if anybody wants any more information about these plans, these programs, please give us a call and we'll sit down and talk to you about them. And we do help with the applications for these programs. Again, we are the SHIP office, your local state health insurance program office. We have a sister program called SMP, or Medicare Senior Patrol. This is the program that focuses on educating and empowering people to identify and report potential Medicare fraud and Medicaid fraud, abuse, and errors. This is why I focus a lot on those marketing do's and don'ts, because we can absolutely help you if you think there is a problem. This would also include billing issues or billing problems that you may be having with providers, or claims problems you're having with insurance companies. If you're not sure, if you get a bill and you don't know why you got a bill, you shouldn't have gotten a bill, we can help you with that. So anytime you have any issues with any aspect of any Medicare benefit, you're always welcome to give us a call and we can help you. And I may have mentioned last week, we are federally funded, which means we don't have enough money. So we are always looking for people willing to volunteer to help us with our mission and to help educate people about what, particularly about fraud and abuse, which is one of the the funner, easier aspects of these programs for volunteer purposes. But we're always looking for volunteers to do any aspect of what we do, whether it's administrative, data entry, all the way to standing up in front of a group of people and talking to them about fraud and abuse. Anybody who might be interested in volunteer opportunities, please give me a call or shoot me an email, and I'd love to talk to you about that. And that is it for tonight, I promise. I do appreciate your patience as always. I know we went a little over time. It's just so much information I think is important for you to have. Again, give us a call, shoot me an email if you have questions. If you want to sit down with a counselor and talk about your situation one-on-one, we're happy to do that anytime. I do have 4 other full-time counselors in our office and 2 part-time volunteers. So there's always someone that should be available to talk to you about your situation. And with that, I will make one more last call for questions. I appreciate that. Thank you in the chat box, Randy. If there are no other questions, I will let you guys go for the evening. Enjoy the rest of your night and hope to see you all next week when we talk about Part D.